Hey, podcast friends. This is Dr. Steve Hewlett with the podcast, Simple Healthy Choices for Weight Loss, where every week we help people who have realized that as their health has been declining over the years, the number of medications they are being prescribed is increasing. We want to help you reverse this health path so you can live the vibrant, pain-free, and hopefully medication-free life you deserve to live. If you'd like even more information on this topic, you can go to Amazon or Audible and pick up my book, Your Plate is Your Fate. And if you think my book helps you on your new health path, please tell your friends and leave a review where you purchased it. Hey, welcome back, podcast friends. And in this episode, I want to talk about blood pressure medications, how they work and the adverse effects of them. And the reason I want to do this is because type 2 diabetes and blood pressure pretty much runs hand in hand. Almost every single type 2 diabetic out there also has blood pressure issues. And almost everyone out there that has high blood pressure is probably on their way to getting type 2 diabetes. And the reason for this is because they both have the same underlying cause. And just like we talked about a few episodes ago about type 2 diabetic medications, they do not cure anything. All they do is treat a symptom of high blood glucose. And that doesn't cure anything. In fact, as I talked about, it actually can make your type 2 diabetes worse. Blood pressure medication is the same thing. All blood pressure medications do is treat the symptom of high blood pressure. It doesn't do anything to cure it. And that's why if you're on a diabetic medication or if you're on a high blood pressure medication, chances are you are going to be on that the rest of your life. Now, the reason why you're going to be on this for the rest of your life is, again, because it only treats the symptoms. And in order to get off medications, off type 2 medications and off blood pressure medications, you have to change the food you eat, because almost every one of these conditions and most organ damage is caused by the same two things. It's excessively high insulin levels for long periods of time, which cause insulin resistance. And it's also from inflammation all over our bodies, because we are subjected to so many chemicals in our environment all around us that this is all inflammatory to our bodies. But what makes it even worse is when we eat these chemicals. And that's what you're doing when you're eating man-made food. All man-made food, box, bottle, bag, can, all that is made up of the exact same ingredients, every single one of them. That's sugar and high fructose corn syrup, it's vegetable and seed oils, and it's ultra-processed carbohydrates. These are all plant-based foods that are killing us. And that's why they're going to great lengths to try to get people to quit eating meat and animal-based products, because they want you eating their food instead. And when you eat their food, then you can get the diseases, and then you can start on the medications. So my job, what I want to do, my passion is to get you off medications and living a good quality life. And the way you're going to do that is changing your nutrition. So I've talked about this and all the other ones, so I'm not going to take a lot of time on this one, because this one is going to be really kind of hard. I don't want to get real sciencey. I don't want to get geeky on you, but it's very important for me to explain how your body handles blood pressure in order for you to understand how blood pressure medications work. So remember, and I did a whole thing. Episode 12 was on how carbohydrates cause high blood pressure. So if you want to understand that, you can go back and read that. So I'm not going to recap anything on that, but there's lots of different ways that our nutrition actually causes high blood pressure. But again, high blood pressure and type 2 diabetes, and actually most of our organ damage is all from the same thing: insulin resistance and inflammation in our bodies. So let me kind of get started and just like I talked about with type 2 diabetic medications, as far as our A1C, we used to have a higher A1C that was fine until the drug companies came along and wanted to sell more of their medications. So they started lowering the A1C. They doing lower and lower and lower, saying that if you have a low A1C of like 5.7 to 6.4, you are pre-diabetic and you need to be started on their medications. Again, they're a business. They aren't concerned with your health. They just want to sell medications. That's fine. My job is to get you away from the medications and into better health. But just like they lowered the A1C because they knew that would bring more people in to get more medications, they've done the same thing with blood pressure. Fine blood pressure used to be considered like 140 over 90. But then the drug companies came in and said, wait a minute, we need to sell a lot more blood pressure medications. So why don't we decrease that to 130 over 80? And then they came in later and now they're saying it's less than 120 over 80. There's been no proof that 120 over 80 is any worse than 140 over 90. All it proves is you're getting more and more blood pressure medications. And what I really want you guys to understand is if you think that your health is fine and you can just take care of any little thing with a medication, that could not be further from the truth. Because anytime you take a medication, they all have multiple adverse effects, meaning that you're taking the medication for one reason, but it screws up so many other things in your body that you have all these adverse effects. And almost every single one of these blood pressure medications is going to cause misfunction of your brain, misfunction of your heart, misfunction of your liver, misfunction of your kidney, misfunction of almost every organ in your body. So all these medications have multiple adverse effects just by trying to take care of one thing, and that usually messes that thing up. And that's why they keep adding more and more medications to take care of all these adverse effects. So the drug company's money is going up, their income's going up as your health is going down. So that's all I'm going to say about that. Let me get right into this. This is going to be kind of geeky. I'm going to try not to make it geeky, but you do have to know some science in order to understand how these blood pressure medications work. So for the first two classes of medications, which are called ACE inhibitors or angiotensin receptor blockers, in order to understand these two classes of medications, you have to kind of understand how the body works as far as blood pressure. So the first thing, I'll go through this as far as if you have low blood pressure, because that used to be the common thing was low blood pressure, not high blood pressure. This all kind of started again when man-made food came into existence. But when you have low blood pressure, say you're working outside in the yard, it's hot, you've been dehydrated, you haven't drank very much water, you've actually been drinking coffee and tea and alcohol and sugar-sweetened beverages and all these other things that actually make you dehydrated. They cause you to lose fluid. And so when your blood pressure goes down, there's two main things I want you to understand. One is called renin and one is called angiotensin. And these two things, it's called the renin-angiotensin system. When your kidneys are magnificent. They control so many things, but one of the things they control is your blood pressure. And so when your kidneys realize that your blood pressure is dropping, it secretes a substance called renin. Okay, so that's renin from the kidneys. Your liver is also always producing another substance called angiotensinogen. When your kidneys notice that your blood pressure is dropping, it secretes renin. Renin comes in contact with this angiotensinogen, and it makes what's called angiotensin 1. Okay? Now, when you have angiotensin 1, your lungs produce an enzyme called angiotensin converting enzyme. It's called ACE. Okay? So you have angiotensin 1, your lungs will produce ACE, the angiotensin converting enzyme, and that converts angiotensin 1 over into angiotensin 2. Now, angiotensin 2 has a couple effects on blood pressure. One, angiotensin 2 directly stimulates the arteries to constrict down. Okay, so remember, this is in response to having a low blood pressure, like when you're dehydrated and out mowing the lawn or whatever. So angiotensin 2 stimulates the blood vessels to constrict down, and it also goes to your adrenal glands and causes them to release a substance called aldosterone. Aldosterone works with the kidneys and causes the kidneys to reabsorb sodium back into the bloodstream. And when you reabsorb sodium, that also causes the water to be reabsorbed, and that brings your blood pressure back up. Now, as far as the angiotensin 2 causing your arterial vasoconstriction, think of this like a garden hose, like your blood vessel is a garden hose. And if you've got water just kind of pouring, coming out the end of a garden hose, and you want to shoot that water across your yard, all you have to do is put your thumb over just half of the end of that garden hose. That's going to increase the pressure on the hose, and that's going to shoot that water all the way across the yard. And that's kind of what your blood vessels do. But instead of putting your finger over the hole, what happens is angiotensin 2 causes your blood vessels to constrict down, become narrower. But it does the same thing. It increases the pressure so you can increase the perfusion coming out the other side. And this is what happens when your heart or your brain or something in your body needs more oxygen, and it knows that your blood pressure's dropped. It's not getting the oxygen and nutrients that it needs. So it needs a blood vessel to constrict down so it can increase the perfusion going to those organs. Okay, so that's what happens. So now along comes our man-made food that's causing insulin resistance and is causing inflammation. And now everybody's walking around with these elevated blood pressures, high blood pressure inside the bloodstream. So what drug companies have done is they've come up with one class that's called ACE inhibitors. Okay, ACE inhibitors, examples of these would be like benazepril, which is low tensin, captopril, which is Capitan, enalapril, which is Vasotec, lisinopril, which is Prevnar or Zestril, quinapril, which is Acupril, and ramipril, which is Altase. If you're on any of those medications, that's called an ACE inhibitor. And just like we said, remember, angiotensin converting enzyme is released from the lungs, and that's what converts angiotensin 1 over to angiotensin 2. So now we have these ACE inhibitors that block that enzyme, the ACE enzyme. So now it doesn't convert over an angiotensin 2. So now angiotensin 2 does not get formed. And so the theory is that lets the blood vessels, instead of constricting, it helps them to dilate and decrease your blood pressure. That's one thing. And also, if angiotensin 2 is not being formed because you're blocking that enzyme, that ACE enzyme, when you block that, you also aren't getting the aldosterone being secreted, which causes the sodium to come in. So that lets, instead of reabsorbing your sodium into your blood, it actually lets the sodium go out, and that's going to help with getting the fluid out of your blood if you have high blood pressure or hypertension. Okay? So I'm just going to say exactly what I just said again, just so you know. So in normal situations, when your blood pressure is low, your kidneys will secrete renin. Renin attaches to the angiotensinogen that's released from the liver, and then that turns into angiotensin 1. Angiotensin 1 is activated by the ACE enzyme, angiotensin converting enzyme, that converts angiotensin 1 to angiotensin 2. So if you block that ACE, then you block angiotensin 2, which means now you don't get the vasoconstriction, and now you don't get the aldosterone being released from the adrenal glands. So that's ACE inhibitors. That's how those work. You're blocking a normal process of the body. The second category, the other thing about this is the adverse effects. There's a big box warning on all these ACE inhibitors. It says when pregnancy is detected, discontinue ACE inhibitors as soon as possible. Drugs that act directly on the renin-angiotensin system can cause injury and death to the developing fetus. So make sure if you're on an ACE inhibitor and you're pregnant or want to become pregnant, you get off of this ACE inhibitor with your doctors, okay, and then let them figure out how he needs to wean you off and switch you to something else. As far as adverse effects, there are many. When you talk about adverse effects, there's some adverse effects that the drug companies know about before the drug ever comes to market. But then there's some they don't know, because once it goes to market, now it's in a lot more people and they start seeing more adverse effects. I will not go through all the different adverse effects to all these medications because there are many, many, many. So as an example, with these ACE inhibitors, there were 78 pre-marketing adverse effects that were already noted. Once it came out on the market, there were another 31 post-marketing adverse effects that were noted with this. And these adverse effects range all over the board because it affects all your body. Like I said, it's malfunction of your brain, of your heart, of your kidney, of your liver, of your sex drive. A lot of these affect your sex drive in a very bad way. So, there's multiple adverse effects to all these medications. So by far the best way is just get off medications, and that's by taking care of your health. So the next one is called ARBs. These are ARBs. This is angiotensin receptor blockers. So with this exact same system I've already explained to you, now what these do is if you have angiotensin 1 and you do have the ACE enzyme that converts that to angiotensin 2, what these angiotensin receptor blockers do is they block the receptors on the blood vessels so angiotensin 2 doesn't work. So remember, angiotensin 2 will stimulate your blood vessels constrict down. So if you block that receptor, that causes them to dilate. So in hopes of decreasing your blood pressure. And a lot of times these don't work, and that's why they put you on 3, 4 different blood pressure medications, hitting it from different angles. But that's why your ARBs are called angiotensin receptor blockers. So it makes where angiotensin 2 does not work. So examples of these medications would be candesartan, which is Atacand, azilsartan, which is a Darby, candesartan, which is Atacand, irbesartan, which is Avapro, losartan, which is Cozar, olmesartan, which is Benicar, and valsartan, which is Diovan. If you're on any of those medications, that's what these do. That's what they're called ARBs, because they're angiotensin receptor blockers. So angiotensin 2 doesn't work. It has exact same box warning for all physicians that as far as pregnancy, because again, these drugs also affect the angiotensin-renin system. So anybody who's pregnant and they're on one of these medications, you need to get off this medication under your doctor's advice as soon as you possibly can. Okay. So that's how those work. The next ones, in order to understand the next set of blood pressure medications, you also have to understand there's different receptors on your blood vessels, and these are called alpha receptors. You have alpha 1 receptors and alpha 2 receptors. Alpha 1 receptors, when those are stimulated, those cause your blood vessels to constrict down so they can increase your blood pressure. Okay, that's when alpha 1 is stimulated. Alpha 2s, when those are stimulated, they actually inhibit alpha 1. So when you stimulate your alpha 2 receptors, it inhibits alpha 1. So instead of getting vasoconstriction, that relaxes the blood vessels and lets those dilate. So with that in mind, remember that there's also called alpha 1 blockers. And remember, because alpha 1, when those are stimulated, they cause vasoconstriction. So we have drugs that block alpha 1, and that causes blood vessels to dilate. These alpha 1 blockers, examples of these are called alfuzosin, which is uroxetrol, doxazosin, which is Cardura, prazosin, which is Minipress, or terazosin, which is Hytrin. So if you're on any of those, again, that's how those work, is they block the alpha 1 receptors. So instead of causing vasoconstriction, it causes the blood vessels to dilate. And just like with the other medications, there are multiple adverse effects with these medications. Oh, and I forgot to tell you, with the angiotensin receptor binders or blockers, those had 9 pre-marketing adverse effects and an additional 11 post-marketing adverse effects after that. So they got 20 different adverse effects that are known, reported, that you could get just by being on one of these medications. Now, back to the alpha 2s. Okay, remember the alpha or the alpha 1 blockers. Those, the ones that I just read, those had 33 pre-marketing adverse effects, and post-marketing effects, they had an additional 34, for a total of 70 different adverse effects that are known by taking these medications. So, okay, that's your alpha 1 blockers. The other thing is alpha 2. Remember I said alpha 1, when those are stimulated, they cause your blood vessels constrict down to increase your blood pressure. So when you block them, hopefully that's going to relax the blood vessels. Alpha 2 actually inhibits alpha 1 naturally. So we also have medication called alpha 2 agonists, which means they actually stimulate your alpha 2 to inhibit alpha 1. So again, they're in hopes that it's going to relax your blood vessels and decrease the pressure inside. So examples of alpha 2 agonists are clonidine, which is Catapress, or guanfacine, which is Intuniv. These medications can lower your blood pressure by doing that, by stimulating alpha 2, which inhibits alpha 1. And again, some of these medications, just with the alpha 2 agonists themselves, pre-marketing, before this ever came to market, there were 114 different pre-marketing adverse effects to this. 114 adverse effects before it ever even came to market. So again, do not think that you're going to take a medication to heal whatever is concerning you, because you're done. When you take a medication, you're actually getting ready to cause a lot more issues in your body. So that's why I'm saying the best way to do it is just stay out of the medical system if you can, which means eat healthy, like all my other podcasts have been saying. So the next one, so we talked about the angiotensin-renin system. We've talked about your alpha 1 receptors and your alpha 2 receptors. The next ones are called beta blockers. You have beta receptors. Yeah, there are beta 1s and beta 2s. We're just going to talk about the beta 1s right now. Beta 1 receptors are located on your heart. When these are stimulated, it causes your heart to beat faster, and it also causes your heart to beat stronger. So when you take a beta blocker, which there are a lot of beta blockers out there, that's what it's doing, is it's decreasing your heart rate, okay? So by decreasing your heart rate, slowing your heart rate, slowing the contraction down, hopefully that's going to be decreasing your blood pressure as well. Again, that's why there's so many different angles on your blood pressure. You can be put on all kinds of blood pressure medication trying to take care of the symptom of high blood pressure, because none of them take care of the cure, which is your nutrition. Keep your insulin levels low and get inflammation out of your body. So examples of beta blockers. Again, a beta blocker, if you can block those beta 1 receptors, then that's going to, instead of causing your heart to speed up, it's going to slow your heart down. Because again, beta 1s cause your heart to speed up, and beta 1s cause it to beat stronger. So if you block those, your heart rate's going to slow down, and your pressure hopefully is going to come down. So examples of beta blockers are atenolol, which is tenormin, betaxolol, bisoprolol, metoprolol, which is toprol or low pressure, nebivolol, which is bistolic, or nadolol, which is Corgard. All these are beta blockers, and that's how they work. They work by blocking the beta 1 receptors. So by doing that, it causes the heart to slow down and hopefully make your blood pressure come down, and also the contractility. But the beta blockers, they have a huge, huge boxed warning telling everybody that if you are on a beta blocking agent and you have exacerbations of angina pectoris or chest pain, in some cases, myocardial infarction have occurred. So if you are on a beta blocker, when discontinuing these, you must get off these, but you need to do it very, very gradually, because if you do it too fast, you can actually make this chest pain even worse. You can make things happen a lot worse. So you need to make sure that if you're on a beta blocker and you're going to get off of it, you do not just stop taking it immediately. You have to wean down, and you have to do that with a physician's guidance, so he can make sure to monitor you as he weans you off these beta blockers. And again, just like with the other ones, pre-marketing adverse effects to beta blockers, there were 87 of them that were known before it ever came out on the market. And then aftermarket, another 14 adverse effects were found as well. So now you have a total of 102 different adverse effects that you can have just by taking a beta blocker. So look at when you take combinations of any of these medications, all the adverse effects are consistently building up. Now, the other thing, there are some medications that do both. They can block your beta 1 receptors. Okay, those are the ones that are on the heart. Those are the ones that when you stimulate a beta 1 receptor, cause the heart to beat faster and harder. So when you block it, it slows it down. But then they also have alpha 1 blocking effects as well. So it slows down the heart and it stops the alpha receptors from causing vasoconstriction. So that's two different ways that this one medication can actually decrease your blood pressure. An example of this is carvedilol, which is Coreg, or labetalol, which is Trandate. And those are two very common medications as well. And they do both, slow the heart down, and they also relax the arterial walls, so your blood pressure goes down. And again, with this one, with the adverse effects, pre-marketing, these medications had 122 different adverse effects. And post-marketing, they found another 9 on top of that. So now you're talking about over 130 adverse effects just with this one class of drugs. Now, the next one is called calcium channel blockers, if any of you are on those. When you have calcium channel blockers, in order to have your muscles contract, you have calcium released across the membrane, and that's what causes your muscles to contract. And you have muscles all over in your arterial walls. So when calcium's released, that also causes blood vessels to contract. So when you take a calcium channel blocker, and you also have calcium channels in the heart, do the same thing. Basically, they inhibit the calcium from flowing in, so it decreases the heart rate. So by blocking your calcium from going over, your heart rate can decrease, and you also can get relaxation of your arterioles. But you're doing it by blocking these calcium channels. And so examples of calcium channel blockers are amlodipine, which is Norvasc, diltiazem, which is Cardizem, nifedipine, which is Procardia, and verapamil, which is Calan. And again, very common drugs for calcium channel blockers. And all these do the same thing. They slow the heart down, and they slow by inhibiting the calcium going across, you're decreasing contractility in the heart and also in the blood vessels. Hopefully that's going to relax it and let it dilate so the blood pressure goes down. And again, just like with all the other ones, the adverse effects, pre-marketing with these, there were 90 different adverse effects already known. And post-marketing, they came out with another 23 adverse effects for a total of 113 different adverse effects with this class of drugs. Now, the next brand, blood pressure medications, are diuretics. And these are, like most of you know, a diuretic is a medication that causes you to lose fluid. So you're trying to get the fluid out of the bloodstream and pee that out through the kidneys. So those are diuretics. And the diuretics are examples of that is hydrochlorothiazide or uretic, chlorothiazodiuryl, bumetanide or Bumex, chlorthalidone, furosemide or Lasix, torsemide or Demodex, and indapamide. All these are diuretics. All these work the same way. They work on your kidneys to cause your body to release sodium out of it. And where sodium goes, water flows. So when sodium goes out through the kidneys, it brings the water with it so you can urinate that out. And hopefully decreasing that fluid in your bloodstream is going to decrease your blood pressure. And just like with all the other ones, when this happens, you're going to lose sodium, you're going to lose potassium, you're going to lose hydrogen ions. So that is one big problem. If you're taking a diuretic, you have got to take a potassium supplement or a salt substitute of potassium because you're going to lose sodium or your potassium as well. And that's a bad adverse effect. Again, pre-marketing, there were 29 adverse effects that were known before this ever came to market. And afterwards, they had another 31 on top of that for a total of 60 different adverse effects from these diuretics. The next one is called potassium-sparing diuretics. There are some medications that they're kind of weak in the diuretic. They don't cause you to lose that much fluid, but they do keep the potassium from being released. So these are called potassium-sparing. It's a weak diuretic, but it keeps your potassium up. And things like this called amelioride is one of the medications, eplerenone, which is Inspra, spironolactone, which is aldactone, triamterene, which is diurenium. And then there's also combinations of a diuretic like hydrochlorothiazide and triamterene, which would be like Maxide or Diazide. And that's usually when you see that. If you're going to be on a diuretic, they're going to put a potassium-sparing diuretic on board. And like I said, in this medication, they actually put them together. So you are losing the fluid, but you're trying to retain the potassium, so you decrease some of the adverse effects. But again, there are multiple adverse effects. This also has the huge U.S. boxed warning about the low potassium. Be careful when you're on diuretics because low potassium could cause heart failure and death. So this is no little thing to deal with. And as far as the adverse effects, we already talked about. Pre-marketing, there were 21. Post-marketing, there were 12. So again, there are already 33 adverse effects just this one drug. And then the last one I'm going to talk about are direct vasodilators. These are the medication when you take these actually directly cause your blood vessels, your arteries to dilate. And again, if you've got a lot of pressure inside your arteries, if you can make those the arteries dilate, get bigger, then hopefully that's going to decrease your pressure. So some of these direct vasodilators are hydralazine or presilene, isosorbide dinitrate like Isodil, isosorbide mononitrate like Imdur, and nitroglycerin. So that's how nitroglycerin works. That's how these work. They directly cause vasodilation in your arteries, hoping to decrease your blood pressure that's occurring. As far as the adverse effects, along with these, pre-marketing, there were already 45 known adverse effects with this medication. And post-marketing, they added another 22. And these are just the ones that are actually reported. There are much more adverse effects with every single one of these medications. These are just what actually gets reported to the doctor. And then when the doctor goes on to report onto the drug companies or to the journals. So pre-marketing, there are 45, post-marketing 22. So that's a total of 67 adverse effects just with these direct vasodilators. I know this was fast and I know it's kind of crazy. And I really hope you understood what I was saying about this. I know I've run out of time, but I just want you to realize how important it is to realize that if you think that you can eat anything you want and sit around and do nothing all you want and get a horrible sleep, not drink very much water, never get out in the sun, and you think that anything that's going to happen to you bad, you can just take a pill to take care of it, That could not be further from the truth. Anytime you take a pill to take care of a problem, it is never curing that problem. It is only symptomatic relief. The only way you can cure anything like type 2 diabetes or high blood pressure is you've got to stay away from ultra-processed carbohydrates, fructose and sugar, and vegetable and seed oils. These things that are in every single man-made product out there that you eat, this is what's killing us. It's killing our organs. You've got to change your nutrition and truly eat for nutrition and not just to put something that tastes good and sweet in your stomach. That's the worst thing you could do. So you need real animal protein, God-made animal protein, meat with fat. And you need, if you're going to have carbohydrates, only eat real fruits and real vegetables, and definitely, preferably from a farmer's market where you don't have to worry about all the other chemicals that these food companies are spraying all over our fruits and vegetables also. So eat healthy. Go back to eating the way we did in the 1800s or before. Eat God-made food and avoid man-made food. And please try to avoid all these medications that you possibly can. And you actually can avoid all of them. You could get off your blood pressure medications. You can get off your type 2 diabetic medications just by changing what you eat. And if you have any questions on that, feel free to scan through all my other podcasts because I talk about it on every one of them. So that's all I have for today. I hope it didn't get too geeky or too sciencey on you. And I know there are, between blood pressure medications, type 2 diabetic medications, and cholesterol medications, those three things, they make up probably at least 80% of all the medications that are being sold out there. And these three medications never used to be in existence until after the 2000s, basically. You know, after our dietary guidelines came out in 1977, the 80s and 90s, they started picking up, and now they are just going crazy. These three classes of medications that only treat symptoms, they do not cure anything. And taking one will automatically cause adverse effects where you're going to have to take another medication on top of that. Now you have even more adverse effects, so you can take another medication, and now you're wrapped up in the medical system. And that's what I want to get you out of. Get out of the medical system, off medications, and start living a high-quality life. So that's all I have for now. Thank you so much for listening. Have a great week. And remember, make simple, healthy choices to live a quality life. If you enjoyed this podcast, please hit the subscribe button below and be sure to tell someone else who may want to change their health path as well. And don't forget, you can also purchase my book, Your Plate is Your Fate, on Amazon or Audible. And if you do, please leave a review.